It is coming. 99% of people do not know it, but it is the baby face. That soft, vibrant fullness we associate with youth doesn't just fade, it atrophies hormonally and structurally. What if I told you that your facial fat is not just a filler, but a critical endocrine organ? According to research in Nature Reviews Endocrinology, 2021, subcutaneous fat under the skin produces estrogen and adipokines, regulating glow, elasticity, and volume. Once lost, those effects vanish unless you know how to restore them. Today, I'll show you 6 proven, minimally invasive techniques to protect and rebuild that layer. Many used in Korea, where aging is seen as a choice. So if you're over 50, stay with me. You're not just going to reverse aging. You're going to understand why you aged and how to reclaim control. Why your face changed, it's not just wrinkles. When we talk about aging, most people think about fine lines and wrinkles. But the real change that makes us look older, especially after 50, isn't just about creases on the surface. It's about what's disappearing underneath. That soft, full look you had in your 30s and 40s came largely from something most of us take for granted: subcutaneous fat, especially in the mid-face and around the eyes. But here's what no one tells you. This isn't just padding. It's a functional endocrine organ. According to a review in Endocrine Reviews, Rosen and Spiegelman, 2014, adipose tissue is metabolically active, producing hormones like estrogen, leptin, and adiponectin, all of which play critical roles in maintaining skin thickness, hydration, and elasticity. Estrogen, in particular, supports collagen synthesis and helps retain moisture in the skin. Leptin helps regulate skin repair and inflammation. And adiponectin improves skin barrier function and reduces oxidative stress. Now here's where it gets interesting. When you lose facial fat, whether from aging, sudden weight loss, or even medications like Ozempic, you're not just losing volume, you're losing a natural hormone factory. And that hormone decline, it shows. A study in JAMA Dermatology, 2018, found that lower facial fat volume was directly associated with deeper nasolabial folds, greater sagging, and more pronounced jowls, even in women who had relatively few wrinkles. In other words, the fat loss itself accelerated visible aging. Making matters worse, many well-meaning skincare routines contribute to what dermatologists now call inflammaging: chronic, low-level skin inflammation caused by overexfoliation, harsh treatments, or even long-term sun exposure. This condition destroys the extracellular matrix and speeds up degradation of collagen and elastin. And if you've been aggressively dieting or over-exercising, the problem worsens. Extreme weight loss, particularly in older women, causes a reduction in both subcutaneous fat and muscle tone, further compromising facial structure and hormone levels. So, if your face looks tired, deflated, or just not like you anymore, know this: it's not your imagination, and it's not just aging. It's hormonal loss through fat loss, and it's reversible with the right science-backed strategies, which I'll be sharing next. The baby face blueprint. Across cultures, the definition of beauty may vary, but the perception of youth is remarkably universal. A baby face, characterized by rounded contours, soft skin, short mid-face, and minimal angularity, is instinctively associated with vitality and innocence. The question is, why does Western beauty culture often work against this? In the United States, aesthetic trends over the past 2 decades have leaned heavily into sharp features: sculpted cheeks, prominent jawlines, hollow under eyes, and exaggerated lip volume. The Texas jawline, for instance, has become a sought-after feature, with many clients requesting sharper, more angular lower faces. But from a dermatologic and optical standpoint, harsh angles and deep shadows often create an illusion of fatigue and age. Dr. Sabrina Fabi, a board-certified dermatologist, noted in a 2022 American Society for Dermatologic Surgery meeting that over-contouring the face disrupts natural harmony and leads to what she called structural aging, where the face may appear done, but not youthful. In fact, studies in facial perception have shown that rounded mid-face volume, not cheekbones, is more consistently rated as youthful. In contrast, East Asian beauty standards, particularly in South Korea, Prioritize softness over sharpness. The ideal is a balanced, hydrated, plump appearance that avoids deep contours and artificial symmetry. Korean women often begin skincare routines in their teens, not with anti-aging treatments, but with barrier repair products designed to preserve hydration and prevent inflammation. It's a strategy of prevention, not correction. Filler, if used at all in Korean aesthetics, is placed subtly to restore, not to enhance or augment. Instead of adding volume to high lateral cheeks or chins, the goal is to restore gentle convexity to the mid-face and forehead. The philosophy is less about adding and more about preserving what was naturally there. And it's no coincidence we describe youthfulness in the West with phrases like soft as a baby's bottom, skin like a newborn, or fresh-faced. Deep down, we recognize that the markers of youth are softness and balance, not harshness and geometry. The baby face isn't about looking young. It's about never appearing to have aged at all. And the best part? You don't need drastic intervention. You just need to rethink what aging really looks like. 6 scientifically supported ways to restore your baby face. Number 1, skin boosters and PRF therapy. One of the most promising advances in modern aesthetic medicine doesn't involve adding bulk to the face. It involves restoring cellular health from within. That's where skin boosters come in. Unlike traditional dermal fillers that are designed to fill lost volume, skin boosters focus on hydration, collagen stimulation, and tissue regeneration. Among the most researched options is PRF, platelet-rich fibrin. Derived from your own blood through a simple centrifugation process, PRF contains growth factors, stem cells, and fibrin matrix that enhance skin healing and collagen production. Unlike PRP, platelet-rich plasma, PRF is 100% autologous, meaning no anticoagulants or additives, and offers slower, sustained release of bioactive compounds over time. A 2020 clinical trial published in Dermatologic Surgery Journal demonstrated that patients receiving PRF showed statistically significant improvements in skin elasticity and texture within 8 weeks, particularly in the under-eye area and mid-face. Other regenerative boosters gaining popularity include exosomes, PDRN, polydeoxyribonucleotide, derived from salmon DNA, and NCDF, new cellular treatment factor, a cocktail of vitamins, amino acids, and non-cross-linked hyaluronic acid. These injectables nourish the skin at a cellular level, boosting hydration and dermal thickness without altering facial structure. In contrast to cross-linked fillers, which behave like implants, skin boosters act more like a skin fertilizer. They help your own tissue repair itself, rather than forcing artificial volume. For aging skin that needs revitalization, not resculpting, these therapies offer a more natural, biologically intelligent solution to restore softness, elasticity, and that subtle glow we associate with youth. Number 2, cherry lips, not overfilled lips. One of the most subtle yet powerful features of a youthful face is the appearance of the lips. Not bold or exaggerated, but naturally plump, slightly flushed, and softly curved. The overfilled, overly defined lips popularized on social media often create an unnatural tension that contrasts with the softness we associate with youth. Instead of using large volumes of filler, modern aesthetic experts often opt for a lip flip, a technique that uses small amounts of botulinum toxin to relax the upper lip muscle. This allows the lip to gently roll outward, exposing more of the natural pink lip and creating a fuller look without the bulk. For daily enhancement, peptide-based lip serums are a non-invasive alternative. These products contain collagen-stimulating peptides and hyaluronic acid to enhance hydration, smoothness, and subtle volume over time. Some include tinted formulas with gradual-release retinol to improve tone and texture without irritation. The goal here is not glamour. It's gentle. A lip that looks like it just finished a lollipop. Innocent, rested, approachable. Youthful beauty doesn't scream, it whispers. And the cherry lip does exactly that. Quiet confidence through softness, not shock value. Number 3, Shurink, Korean Ultherapy versus Ulthera/Thermage in the US. High-intensity focused ultrasound, HIFU is a non-invasive technology that targets the deeper layers of the skin, specifically the SMAS layer, the same area lifted during surgical facelifts. In South Korea, the most popular form is Shurink, a refined, high-frequency version of HIFU used routinely for facial tightening and skin rejuvenation. Unlike Ulthera or Thermage in the United States, Shurink is used more proactively and with lower energy settings at higher frequency intervals, often every 3 to 4 months. This repeated, controlled stimulation improves skin elasticity over time without triggering inflammation or fat loss. A 2021 meta-analysis published in the Journal of Cosmetic Dermatology confirmed that HIFU leads to measurable tightening in the mid-face and under-eye area, particularly when subcutaneous fat is still present. The results are most impressive in patients under 60 or in those who maintain healthy facial fat. In contrast, many American patients report disappointment with Thermage or Ultherapy because the technology is often used too late, after significant facial volume has already been lost. Without fat to support skin structure, tightening treatments may produce a hollow or drawn look. Ultimately, non-invasive lifting only works if there's something left to lift. That's why early intervention and fat preservation are critical in achieving subtle, natural-looking results with HIFU treatments like Shurink. Number 4. Minimal fillers. Less is more. One of the biggest misconceptions in aesthetic medicine is the idea that volume loss from aging can be fixed by simply adding more filler. Some clinics recommend as many as 10 to 15 syringes, roughly a tablespoon of product, to replace what is lost by age 40. But here's the truth. Synthetic filler cannot replace hormonally active fat. Facial fat isn't just structural, it's endocrine. As discussed in endocrine reviews, subcutaneous fat secretes estrogen, leptin, and other hormones that support skin health, circulation, and collagen production. A syringe of hyaluronic acid gel, no matter how expensive, does not perform these functions. Overfilling the face can actually backfire. Too much volume in the wrong places leads to distortion, puffiness, and an unnatural appearance. It also compresses natural tissues, impairing lymphatic drainage and creating a pillow face effect, often seen in overcorrected patients. Instead, strategic microfilling in key areas, the under-eye hollows, mid-cheek volume loss, and forehead smoothing, can restore softness without bulk. The goal is not to sculpt, but to soften. In well-trained hands, less truly is more. Preserving the natural curvature of your face and working with what's still there, not masking it, keeps you looking refreshed, not redone. Number 5. Sheet masks and daily regeneration. Often dismissed as a skincare trend, sheet masks are actually one of the most effective tools for daily skin recovery, especially for mature or inflamed skin. Think of them as a spa in a sachet, concentrated treatment, pre-dosed and ready to deliver maximum hydration and calming effects in under 20 minutes. The key lies in the active ingredients. Centella asiatica, a time-honored medicinal herb, has been clinically shown to reduce redness and improve skin barrier function. Snail mucin, rich in glycoproteins and hyaluronic acid, enhances wound healing and elasticity while delivering deep hydration. Avocado extract contains oleic acid and phytosterols that soothe and replenish the skin's lipid barrier. When used consistently, 2 to 3 times per week, these masks can visibly reduce fine lines, calm irritation, and boost radiance. A 2019 study in Clinical, Cosmetic, and Investigational Dermatology found that sheet mask users had significantly higher skin hydration and reduced transepidermal water loss within 4 weeks. More than a luxury, sheet masks are daily regenerative therapy. Simple, affordable, and surprisingly powerful. Number 6. PDO threads, not permanent threads. Polydioxanone, PDO, threads have become a favored technique in modern aesthetic dermatology, particularly for women seeking skin tightening without surgery. But not all threads are created equal, and how they're used makes all the difference. PDO threads are absorbable sutures placed just beneath the skin. As they dissolve, they stimulate the body's natural collagen production, gradually firming and smoothing the treated area. The key benefit isn't the lift itself, it's the biological response they trigger. In Korea, where PDO threads are widely used, providers favor placing them in non-dynamic areas, regions of the face that don't move much, such as the lateral cheek, jawline, or under the chin. This minimizes complications like thread migration, dimpling, or extrusion. In contrast, many American practitioners have historically placed threads through high-motion zones, such as the nasolabial folds or marionette lines, leading to higher rates of irregularities and patient dissatisfaction. The newer philosophy is simple: less trauma equals more collagen. Instead of pulling tight, the goal is to gently stimulate tissue repair over multiple sessions. Think microbarb threads, placed in a fan pattern to support skin density, not aggressive lifts that distort natural anatomy. With the right hands and a conservative approach, PDO threads offer a subtle yet lasting improvement, especially when combined with skin boosters or PRF. Real stories: baby face after 60. Case 1. Joan, 67, from hollow to harmonious with Korean-inspired therapy. Joan, a 67-year-old retired nurse from Michigan, had never considered aesthetic treatments until her daughter's wedding was coming up. Years of sun exposure and sudden weight loss had left her with hollow temples, deep marionette lines, and a tired expression she didn't recognize. Her provider recommended a non-invasive plan inspired by Korean aesthetics. 3 sessions of Shurink HIFU, combined with PRF injections and centella-rich sheet masks for at-home care. No fillers, no Botox. The change was slow, but stunning. By the wedding day, her mid-face looked softly lifted, her under-eyes brighter, and her skin tone even and glowing. She hadn't tried to look younger. She simply looked well-rested, cared for, and natural. And that made all the difference. Case 2. Carol, 61. Filler fatigue to facial balance. Carol, a 61-year-old Pilates instructor from California, had spent years chasing perfection through cheek fillers and lip augmentation. The result? A stretched look, over-accentuated cheeks, and what she called her Instagram face, one she never saw in the mirror. When she visited a new clinic, they offered a reset, filler dissolution, followed by minimal lip flip, skin boosters, and microthread lifts around non-dynamic areas like the jawline and temples. The outcome was not dramatic, but it was profound. Her features softened, and for the first time in years, she felt comfortable smiling without makeup. People stopped asking if she was tired. One friend said, "You look like you, 10 years ago." The takeaway? Aging doesn't demand a total reinvention. With the right approach, it's not about hiding age. It's about revealing the health, softness, and vitality that was always there. And often, it takes less to bring that forward. What's aging you without you knowing? While genetics and time play their part, many of the things that accelerate visible aging are self-inflicted, and we often don't realize it until we've lost something we can't easily get back: facial fat. Let's start with weight loss drugs like Ozempic and Wegovy. These GLP-1 agonists are effective for reducing body fat, but they don't discriminate. A recent NEJM study confirmed that GLP-1 users experience significant volume loss in the face, particularly in the cheeks and temples. The result? What's being called Ozempic face, a gaunt, prematurely aged appearance. In fact, a 2023 report presented at the American Academy of Family Physicians noted that 25% of primary care visits now involve patients inquiring about GLP-1 drugs. It's a cultural shift, and our faces are paying for it. But medications aren't the only culprit. Overexercising, especially cardio-intensive routines, can lead to muscle and fat loss in the face. Add to that low-protein diets and inconsistent sleep, and the hormonal signals needed for collagen production and fat preservation start to fade. Even well-intentioned fasting routines, if not balanced with protein and hydration, can contribute to facial volume depletion. The issue isn't weight loss, it's unintentional face loss. The good news? With the right strategy, nutritional support, PRF, skin boosters, and hormonal balance, you can preserve and even restore your baby face foundation. Understanding what's aging you is the first step to reversing it. If you want to see these ideas in action, watch my next video, Korean Beauty Street Walk, Real Clinics, Real Results. You'll see how everyday women in Korea approach beauty through prevention, not correction. Have you tried PRF, microbotox, or PDO threads? What was your experience like? Drop your thoughts in the comments. I'd love to hear from you. And don't forget to like, subscribe, and share if this video brought you value.